Hi, I'm Camille from Pareto Education and welcome to our YouTube channel. Today, in this video, we will be talking about dysphagia. Dysphagia is the medical term associated with difficulty swallowing. This can be for solid food, fluids, or sometimes both. To clarify, painful swallowing is odynophagia, whereas dysphagia is difficulty swallowing. Dysphagia is a concerning symptom for both the patient as well as the clinician, and it's important to understand, recognize, and when to make that all-important referral. Dysphagia can occur due to three main problems in three systems. Firstly, neuromuscular disorders. These include problems with the nervous system, including stroke, motor neuron disease. Secondly, obstructive disorders, anything such as a stricture or an esophageal cancer. Thirdly, motility disorders, including achalasia. You will find that many patients present with a sensation in their throat. This is called globus pharyngeus, and is important when you're taking this history to have a comprehensive history before diagnosing dysphagia. Be sure to ask targeted questions, such as, are they having problems with liquids, solids, or both? And which problem started first? Is the food getting stuck? Is there any regurgitating, gurgling feeling, any vomiting? Does the patient feel any lump in their throat? Another important question is to ask about heartburn-like symptoms. Also ask, has the patient got any weakness elsewhere in the body? Finally, it is important to rule out red flags: weight loss, loss of appetite, hematemesis, hoarseness or changes in the voice. If a patient presents with any of these red flag symptoms, or you are concerned about a patient presenting with dysphagia, you must make an urgent referral for a 2-week wait. In most cases, these patients will need an upper GI endoscopy. Let's see a case in example and we'll take it from there. Hi, I'm Camille, one of the physician associates at the practice. Can I begin by taking your name and date of birth, please?
I'm John Davis and I'm 63 years old.
Perfect. So, Mr. Davis, how can I help you today?
I'm not feeling too good, I'll be honest with you. I've had a lot of trouble with my swallowing.
I see.
And it's really been affecting how I'm eating and really, frankly, my ability to eat. And I've been putting it off, but now I really need it seen to be honest, and I'm hoping you can help me.
I'm really sorry to hear about that. It seems like it's affecting your life significantly. I'm sure we can help you today. So tell me a little bit more about this symptom. So you're saying you're having difficulty swallowing.
I don't know if this is normal or it's just problem swallowing. Whenever I eat something, it feels like it's getting stuck, and I really just struggle to kind of swallow and make sure it goes down. And it goes down, but it goes down with a lot of difficulty. And sometimes it doesn't go down and comes back the other way.
So you're sometimes having vomiting episodes?
Not vomiting, if I was to be honest. It's kind of like, I don't know what the word for it, but it just kind of comes up and then comes out of my mouth.
Regurgitation maybe?
I'd probably say that's more appropriate.
Yeah. So not fully down vomiting after the meal, but kind of when you're swallowing, you feel like perhaps it's not going all the way down and it's coming back up.
Yeah.
I'm sorry to hear that's quite significant. So let's explore this symptom a little bit more, and then we can take a full medical history and hopefully present you with a plan. Is that okay? So when did you first notice this happening?
I think it's been about maybe 6 weeks.
6 weeks. And has it been, did it start all of a sudden? Has it been getting progressive better, worse?
Well, I first felt that my throat felt a little bit heavy.
Okay.
And then that kind of heaviness has moved kind of down to my chest. It's not pain, but it just feels like there's something stuck.
So there's no pain on swallowing?
No, it's not painful.
It's difficult?
It's difficult.
Okay.
But initially I thought I might have just got a sore throat, and I tried to just manage it the best I can. I asked somebody and they said maybe it's just a bit of heartburn and maybe try some peptac liquid, but it didn't help at all. And over the last 8 weeks, it's just been getting progressively worse, and I'm really worried.
And during this time, is it the type of foods affect you? Is it all foods or only some foods, tougher to eat foods, that kind of thing?
I mean, I quite like, I wouldn't say I've got the best diet, so I do quite like having, pizzas, garlic bread, etc., wholesome food, potatoes. And it's those foods that I struggle with the most.
Okay.
But recently I've realized that it's even softer foods.
Things like mashed potato, for example?
No, I would probably say, mashed potato I can get down.
Okay.
But, if I was to, for example, have something a little bit harder than that, maybe some boiled carrots as an example, It's tough.
Yeah.
You know, it's uncomfortable.
What about foods, thinner foods such as soups, yogurts,
They're okay.
ice creams?
They're fine.
Okay. And what about liquids as such? Do you have any issues with the liquids?
I haven't had any problems with liquids.
Okay.
So that's reassuring.
Have you associated during this time any change in your appetite? I know sometimes if it's a chore to eat, such as you're describing, has there been any change in your appetite during this time?
It's getting me down because I can't eat the things that I like. And initially I really just wanted to eat. But now I just don't feel right. I just feel like I'm off my food. I'm always very tired and,
I understand.
you know, not feeling 100%.
Okay. And during this time, have you had any other symptoms? So you said you've not noticed any vomiting, but have you had any blood or sort of a darker type of vomit or regurgitation type?
Not a darker type of vomit.
Sometimes they describe it as like a coffee ground. It looks kind of dark.
No, nothing like that. I tell you what I have had. My wife noticed. She reckons I've lost a bit of weight.
Yeah.
I don't know whether that goes with the tiredness and all. I'm just worried.
So you have noticed some weight loss. How much would you say roughly?
I don't know. I mean, my wife keeps telling me that, and then she sees me every day, right? And she's like, you know, you're losing weight.
Fine. Are you experiencing any abdominal pain during these times or anything? I know you've not noticed any pain when swallowing, but after a meal perhaps, or even when you're having hunger pangs, do you have any abdominal pain as such?
No, not really. My tummy feels fine.
Yeah.
I have no pain.
And have you experienced any change in your bowels or movements?
No diarrhea, no constipation, nothing like that.
No dark stools, sticky stools?
No, I mean, that sounds horrible, but I'm glad I haven't got any of that.
Fine. Any other symptoms that have been going on for the past 6 to 8 weeks you mentioned? So any sort of dizziness, any sort of, you mentioned some fatigue symptoms, but anything that's just chest pain, shortness of breath, anything like that?
No, none of those symptoms.
Okay. And have you noticed a more specific sample? So sometimes we ask patients if they've noticed any change in their voice, hoarseness, for example.
I think my voice is okay. You know, like I said, it's just the swallowing.
Yeah. And would you say that's the main issue? So if I was to summarize, presenting with 6 to 8 weeks of difficulty swallowing, mainly due to solid food and weight loss associated with that.
I think you've hit the nail on the head.
Okay. So moving on from this, just to confirm your past medical history, do you suffer from any long-term health conditions that you see regular health practitioner for?
No, well, I mean, I've got high blood pressure.
Yeah.
So I see some of your colleagues maybe once a year.
For some blood tests, for some blood pressure monitoring?
Yeah, absolutely. Okay. I've got diabetes as well.
Okay.
So I've got diabetes type 2. So I kind of, I get regularly checked up for them.
Okay.
I've had asthma for a long time, but that's really well controlled. But aside from that, I'd like to think that I'm quite well and keep active.
And just in terms of your medications associated with that, is your blood pressure under control?
Yeah, as far as I know.
Yeah, and which medications do you take for this?
So I'm on Ramipur.
Okay.
And I'm on amlodipine.
And which doses would you say?
I'm on 10 milligrams of Ramipur.
Yeah.
And 10 milligrams of amlodipine.
Oh, that's really good. Some people don't know their doses, but it's really good.
Oh no, I like to keep on top of it. Or rather, my wife keeps on top of it, and I just remembered what my wife always tells me.
And the diabetes or type 2, are you insulin dependent, tablet controlled? Or?
Well, I'm tablet controlled. I'm on metformin.
Fine.
But the specialist nurse told me that my diabetes levels are looking quite good.
And for asthma, you take an inhaler, I'm assuming?
Yeah, I take the blue inhaler, Ventolin, and I take the brown inhaler.
Okay. And do you have many exacerbations? Are you any change in these conditions?
No, I've been stable on asthma for a long time.
And even on your diabetes and high blood pressure, there's been no recent change. Are you allergic to anything?
No.
No allergies. A little bit about your social history, if I may ask. We ask patients who are presenting with similar symptoms about smoking history.
I do smoke.
Yeah.
I can't lie. I smoke definitely more than I should do. A pack or 2 a day.
Up to 2 packs a day.
Yeah, I would say so.
Which is 40 cigarettes.
Yeah. It's a hard habit to kill, really.
Of course. Thank you for telling me that. And how long have you been smoking for?
I'd probably say as far as I can remember.
Really? Many years?
Many years. Decades.
Fine. And any alcohol use?
No alcohol use.
Teetotal?
Yeah, I used to drink a fair bit. Probably about 10 years ago, I stopped drinking.
Okay.
Completely.
And you said your diet, sometimes you indulge in, pizzas and this kind of thing. Are you a fairly active person or?
I'm active. Yeah, I'm active. I play regular at the squash club.
Okay.
You know, I try to go for long walks with friends, with my wife.
Yeah.
So I keep myself active. But yeah, you know, diet-wise, I do enjoy, you know, good, wholesome fried food.
Fine. And what about your employment? What line of work are you currently working in?
I'm semi-retired.
Okay.
I was an accountant, and you know, I'm in the fortunate position that I can semi-retire. So I semi-retired 2 years ago.
Perfect. And moving on from that, is there any sort of other, you have to ask everyone, any sort of illicit drug use, anything that's you can disclose to me?
No, being clean.
Fine. Let me ask a little bit about your family history. Is there any medical conditions that run in the family? You know, things like heart disease, diabetes, any types of cancers, for example, anything like that?
No, not necessarily.
Okay.
None of those things that you've mentioned.
So I'm talking about your parents. Are they still alive? Or?
No, they passed a long time ago, and they both passed of natural deaths.
Okay.
But as far as I'm aware, they weren't on any medication.
And your siblings?
I'm an only child.
Oh, fine.
Well, I'm not a child anymore, but yeah.
Okay. So in terms of what's been happening here, do you have any specific concerns? I know it's quite worrying, the symptom itself. Was there any particular concerns you had or ideas about what it could be?
I don't know. I try not to read around on Google. I'm really worried.
Yeah.
It's not normal for anybody to not be able to eat properly and comfortably. And I just want it really looked into, please.
Of course. And when you came to me, was there a certain expectation that you had about, how I would deal with this complaint today?
I just, like I said, you've asked all of the questions. I'm just keen to know what you think is going on.
So with these symptoms, they are a little bit worrying, I must say.
Okay.
So from our perspective here, it's better to be on the safe side. Now, a symptom such as difficulty swallowing can sometimes be related to a multitude of factors. Sometimes these are sort of benign conditions which are non-serious and they can resolve. And sometimes they can be more worrisome underlying conditions. You're saying that you're fit and active, so some of the things such as musculoskeletal issues. So some of the conditions such as neurological conditions, I'm less worried about. Things like motor neuron disease or stroke. I mean, you say you've been active since that, and that's the only real symptom that you've experienced. But in these circumstances, it's very important that we have a look. Mm-hmm. So we have a camera test called endoscopy. It's called a gastroscopy, and the camera test goes into the mouth and looks at the food pipe, the esophagus, and also the stomach.
Okay.
Now this will give us a visualization of if there's anything in there that's can be causing these issues. So because of the nature of the symptoms you've described, in addition to your age, and you've got certain risk factors such as your long smoking history, we are a little more worried about yourself as compared to someone else who didn't have those symptoms.
I mean, I'm worried about myself, so,
Yeah. So given all this into account, I'm going to send you on it's called a fast track referral.
Okay.
Now what this enables us to do is kind of put you at the front of the list, if that makes sense. This will enable you to have this endoscopy and go through these testing a bit sooner than a normal referral would allow us to do. Normally within a 2 to 3 week period.
Okay.
The reason behind this is because some of these symptoms can indicate, now I don't want to worry you prematurely, but
it's okay, I'm prepared for whatever.
We have to be honest and upfront. Some of these symptoms can indicate occasionally towards a cancer.
Fingers crossed it's not.
Absolutely. And it's very good that, you've came to us and we can arrange these tests straight away and get to the bottom of this. If it is or it isn't, at least we know, and then we can start to make a plan. Okay?
That sounds good.
So what I will do, I will make the referral today. If you don't hear anything within the next week or two, I want you to call me back and then we can chase that up for you. But you should be able to get an appointment within the next 2 weeks.
Brilliant.
The camera test, the endoscopy, someone will explain and consent you fully, and then you can go ahead with that.
Sure.
Here are some leaflets that explain the procedure anyway in the meantime. And if you have any further questions or your symptoms deteriorate in any way, you're having any problems further with your swallowing, you become painful swallowing, or you begin to start having issues with liquids or breathing, any vomiting of blood, any dark stools, or if you're totally off food and you're unable to eat, please get in touch with us immediately. Or in serious circumstances, it's to the hospital.
Okay, so that's clear.
So do you have any other questions for me at this moment in time?
No, not at the moment. You've been really, really comprehensive. Thank you so much.
Okay, thank you very much, and we'll see you with the results of your tests.
Thank you.